I will talk about our novel theranostic light endoscope system for imaging, light delivery and therapy response monitoring. I am Ulaş Sunar, Associate Professor at Wright State University in the Department of Biomedical Engineering. I also hold endowed chair position in medical imaging. I will show you two applications, clinical applications. One is for oral cancer, the other one is the ovarian cancer, but the system can be applied for many other applications, including brain and also vascular diseases. So for the oral cancer, ENTs and oral surgeons can be interested on this system. ENTs for the oral cancer screening and also for the surgeons for biopsy guidance. Dentists see many patients. The main challenge is 95% of them is the false positive. They don't know whether the lesion is cancer or not, or benign, malignant, or any other disease stage. They cannot tell about it. So we want to provide quantitative images that can lower the false positive rate. This will definitely benefit the dentists, so they can bring any continuous source of revenue, and it can also advertise this technology for that it will differentiate their practice compared to the others. For the surgeons in the surgical environment, the main challenge is they cannot know the extension of the disease, and also with respect to the depth, they have no idea about how much it extends. We can provide image-guided surgery and also depth resolve images so that we can eliminate at least 50% of the biopsies, which would reduce the cost in the hospitals. When we discussed these ideas with the surgeons, definitely they were saying that only about a minute of the imaging wouldn't add any problem or any challenge for them to include this imaging system in their screening method or biopsy guidance method. For the market, we see that 3.5 million patients are being screened in the dental by the dentists, and among them at least around half of it, there is no image guidance. It's just a visual inspection. So definitely there is a need for the adjunct modalities that can guide the dentist. For example, during the surgical case, we can use this device to mark the extension of the lesions. And also there is new modalities like a light therapy that we are using this light to treat the cancer, so that the endoscope can deliver also the treatment light. The advantage is that compared to the radiation, this has a much lower dose toxicity, less side effects, so that it also preserves the important function like a speech and swallowing. So by using this device, we can have usually the surgeons see or dentists see as a visual inspection, but they cannot detect like this the residual tumor cells that leaking during the surgery. It can be missed by the surgeons or dentists. But with the quantitative imaging method by the endoscope, we can detect a small cells or small tumors. This can also induce a quantitative contrast. So this will be a quantitative number rather than just arbitrary images. So we can allow first seeing the lesion, then according to that lesion, then treatment plan, like treatment plan or surgical plan can be arranged. This would eliminate the recurrence rates and side effects, reduction of these side effects. The second application is for the ovarian cancer in the intraperitoneal cavity, which is a very large area. Surgeons take out the most of the tumors, but they may not know, because it's a spread disease, whether there is a residual tumor cells left or not. So we came up with the endoscope method that we can detect these small tumor nodules that cannot be visible by the eye, and also we can treat them with the same endoscope by sending the light. This will eliminate the side effect, systemic side effect that radiation or chemo would have, because we are only illuminating the light at the target site, so that, for example, we are not illuminating the intestine or liver area, which can be which leads to the reduction of the side effects. This is for example, one drug that in the clinical settings, photodynamic therapy, the light therapy, that we are treating the cancer patients, oral cancer patients. So one idea was that we put into the nano balloons, and inside we put a chemo drug. So we only release this chemo as soon as we hit with the laser. So we can arrange that where to release it and when to release it with this endoscope. This is the example of this nano drug that encapsulated, but after the laser, that it releases the chemo drug. So the advantage of this endoscope, again, we can know exactly how much drug we are releasing and when to stop and where we are releasing. We want to just release at the target on the tumor. So here is the real-time movie, for example. We are releasing the drug at the target area. We are not releasing, for example, the intestine area. So this would allow us real-time how much drug concentration, absolute number, we are releasing at the target site. This endoscope allows this why monitoring in real time, also releasing in real time, so it allows the dosimetry and also monitors the therapy. Without this endoscope, the surgeons has to take the biopsy and quantify the drug, how much drug is there. We are basically, with this non-invasive technique, we can allow the quantitative real-time monitoring of the therapies. Thank you.